living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Adverse childhood experiences, or ACEs, are traumatic events endured by people under the age of 18. Studies show ACEs are strongly related to risk factors for disease and health and social well-being throughout the rest of people's lives. Healthcare organizations are working to recognize and appropriately respond to these traumatic events, as well as learning how to prevent them. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Welcome back to Healthy Living for Life. When children suffer trauma from unstable home environments, neglect, and abuse, the effects can be devastating and long-lasting. With me today is Tina Eblin, Director of the KWYB Institute, which is behind the statewide movement called Elevate Montana. Thanks for joining us, Tina.
Thanks for having me.
What is the KWYB Institute?
Well, the KWYB Institute was created because Intermountain Children's Home, which helps severely emotionally disturbed children, decided that they wanted to prevent things from happening to children. So they decided that they would create a separate institute that would advance awareness. They would also accelerate knowledge and advocate for change so that we can be more preventative instead of reactive to the well-being of Montana's children.
So what about Elevate Montana?
So Elevate Montana actually grew out of KWYB Institute. So we were trying to think of a way that how do you spread this information to communities, and thought, you know what, we need to elevate Montana to a different level. So it was a grassroots movement that was created to work with communities and really wrap around children and understand that the entire community needs to come together to really elevate the well-being of Montana's children.
So you mentioned Intermountain, and
Yes.
Intermountain is in Helena.
Yes.
Talk to us about Intermountain.
So Intermountain Children's Home is over 100 years old. They serve thousands of kids per day, and they're also in schools. They have group homes. They also do outpatient therapy as well. So it's a very large children's mental health network.
Are there KWYB institutes in other states?
No, KWYB Institute is strictly in Montana.
How about Elevate Montana, similar program elsewhere?
Well, we were actually awarded a grant called the Mobilizing Action for Resilient Communities grant, which we were one of 14 communities that received this grant. So there are other programs that are somewhat like Elevate Montana, but not to the scope of having 11 communities involved.
So we've introduced the topic of adverse childhood events. Can you talk about ACEs? The
Yes.
acronym for that?
Yes. So adverse childhood experiences are experiences that people could experience between the ages of 0 and 18. And it was actually created from a study that took place and was published in 1994. And it was two physicians. One was a weight loss clinic physician, and another one was a cardiac physician out of Georgia. They both realized that childhood experiences impact us as adults and impact our physical health. So they did a study. They had 17,000 participants, and what they found was 2/3 of those participants had experienced an adverse childhood experience. And there are 10 of them, and they include household dysfunction, so someone in the family incarcerated, someone in the family suffering from addiction issues, mental health issues, parent separation or loss of parent. There is neglect. physical and emotional neglect and abuse, physical and sexual abuse, physical, emotional, and sexual abuse. And then there is loved one being, intimate partner violence is another one as well. So the ACE study, when you take that, you add up the score. So you can have a score from 0 to 10.
So the ACE score, and I said adverse childhood events, and it's really experiences.
Yes.
So talk more specifically about how those events or experiences really affect a person's health.
So when a child is developing, so your brain doesn't fully develop until the age of 25, so it's constantly changing. And when your body is under what we call toxic stress, and what happens is that your body releases adrenaline to begin with, and that's short-lived. So you have about 30 seconds for your body to use the adrenaline. But when you are experiencing something very traumatic, what can happen is then cortisol is released. And cortisol is important for your body, but what happens during childhood is when you're constantly under stress, that cortisol becomes toxic. And it can cause changes in brain chemistry. And also, if you think about a child whose body is developing, what can happen is with the cortisol, it shunts the blood away from forming organs, for maturing organs. And so it goes out to muscles. So if you can think about a child who's constantly having that cortisol pumping through their body, their organs may not be forming as they normally would.
So we've got a little less than a minute left, but can you talk about what an adult could do if they know they experienced some of this trauma in their childhood?
Definitely. So as an adult, talking to your healthcare provider is one way. Also mental health professionals. Really, it's about recognizing that these things happen and maybe connecting those links of, oh, I experienced trauma as a child. Maybe this is what is causing issues as an adult.
Thank you so much, Tina. Well, we need to pause here for a short break, but coming up next, we will learn about resiliency and trauma-informed care. Stay with us. Welcome back. We're talking to Tina Eblin of ChildWise Institute. Thank you, Tina, for addressing this important information. So before the break, we were talking about resiliency. So talk to us about that. What is it?
So resiliency is the ability to, when you're dealing with something difficult, be able to then return back to normal and cope with the issue at hand.
So is teaching resiliency something that healthcare providers and maybe educators can do? Absolutely.
Different things like mindfulness, meditation, physical activity, also, getting enough sleep can all help with resiliency.
So we hear about trauma-informed care. So what can a provider or an organization do?
Well, for a provider, what's really important is to understand, especially if you're a healthcare provider, that a lot of clinical issues that people present with could be tied to stress, and having that understanding. As for organizations becoming trauma-informed, really understanding that all of us have stress, which is really what trauma is stress, and that they have the ability to help employees or help patients dealing with stress.
I hadn't heard much about trauma-informed care until fairly recently, the last year or two. It sounds like a new movement. Is it?
It is. I would say within the last 5 years, it's really taken off. Yes, I think in the future we'll see way more organizations understand that becoming trauma-informed is an important piece to business.
So are there organizations in our own communities that are trauma-informed?
So there are organizations that are working towards it. Intermountain is one of those, Show Dare is one of those. Also, we have a business in town that is really working to become trauma-informed, and that's the McDonald's in Helena.
Oh, that's good to know. So what does an organization actually have to do? I mean, is it a certification or accreditation?
Currently, no, it's not. For us, like working with McDonald's, it was training upper management and getting their buy-in with understanding why is it important to understand adverse childhood experiences, and being able to train managers and supervisors to recognize when their staff is stressed or when their staff is dealing with difficult situations.
So if I went to my provider and I'm ill or needing some assistance, how would I be able to tell if my provider is trauma-informed? Would I notice anything if I were a victim maybe of trauma as a child?
The only way I think you would be able to recognize is if they ask for your ACE score or ask you to take the ACE survey. That's how you would recognize if they're trauma-informed.
So are there a lot of providers around that are getting training on ACE and how to administer that tool?
So there are more and more providers that are wanting to understand the impact of adverse childhood experiences. Currently in Helena, there are pediatricians who are giving the ACE survey to parents and seeing, what that score is and helping connect them to different things like parenting classes or mental health providers.
So let's go back to ACE. Give me some examples of some of the questions. You probably have some of them memorized by now, right?
So one question is, did you grow up in a household where someone had an addiction issue to drugs or alcohol? Another one is, did you grow up in a household where you lost a parent or a caregiver? Or did you grow up in a household where you went to school not fed, or you had dirty clothes, or you didn't feel like you had attention? So that's a neglect question.
And remind us again, if it's a score of 4 or more, you're at risk?
Well, you're basically at risk at any score from 0 to 10, but the tipping scale is 4 or more. So they have found that there's a dramatic increase in physical health problems, the possibility of having physical health problems at 4 or more. So it increases, like heart disease increases over 300%. If you have a score of 4 or more.
Amazing. So we talked about children and being administered the survey, pediatricians and the like. What about adults? Should that be used for adults as well?
I definitely think it should be. It will give an insight to maybe there was a lot of stress in this person's life, and maybe that's what has led to the diagnosis that they're seeing their physician for. I think it should be administered to adults as well.
So there's some educational programs around that I've seen maybe in the newspaper on the ACE scoring system. So talk about that. Are there any upcoming sessions or anything that someone who wants to be educated about ACE?
So people can always go to childwiseinstitute.org to get some information, also elevatemontana.org. But we have 11 communities within the state who have become Elevate Montana affiliates. And within those communities, they have people who have been trained to present on adverse childhood experiences. So they are going out giving presentations quite often.
Oh, that's excellent information. Thank you so much, Tina. Well, coming up next, talking about cultural issues is a great segue to our next guests who will join us to discuss trauma-informed care in Native American healthcare organizations. Stay with us. We're joined now by Dorothy Dupree, who recently retired from her position as Director of the Billings Area Office of Indian Health Service. Thanks for being here, Dorothy.
Very much my pleasure. Pleasure, Sarah.
And
a little bit nervous, but
oh, don't be.
I'll
don't
hang in
be.
there.
Absolutely. And congratulations on your retirement.
Thank you.
I'm so happy for you.
Thank you.
A lot of years with the Indian Health Service. How many?
29, about 29 and a half years.
That's excellent.
Never quite made my 30.
Well, that's all right. That's all right. Well, you look great, and congratulations.
Thank you.
So what is the Billings Area Office, Indian Health Service Office? What is that?
It's a subunit, I'll call it that, of the Indian Health Service nationally. The Indian Health Service is headquartered back in Rockville, Maryland, and we have 12 area offices. The Billings area is one of them, and we serve the tribes in Montana and Wyoming.
And what facilities does it include?
We have 3 hospitals, 2 of which are critical access, and 3 large ambulatory programs.
So which hospitals are they?
The 2 critical access hospitals are located at Fort Belknap and Crow Agency. And
Okay.
the acute care hospital is located in Browning. It's the Blackfeet Hospital.
Okay. Who do they serve?
The tribal individuals that reside on or near the reservation.
Okay.
They don't, it could be any federally enrolled tribal member without cost. Direct care is what we refer to that as. And then those who are residents of the reservation are funded for care that we cannot provide through purchase referred care.
So we've talked about adverse childhood experiences. What is that like for the folks that are living on or near reservations and experiencing that?
Well, first of all, before maybe I can talk a little bit about why adverse childhood events, why trauma-informed care. I've been an area director in 4 other areas. Well, this is my 4th area. In coming to the Billings area, I was always asked, why is it so different? Why is it different? Why is it that we're not making the gains that we have in other areas here in the Billings area? And after a lot of close observation and listening to the patients and patient complaints, it really is about trauma and the re-traumatization when they come into our facilities, because we're not taking the time. Every patient complaint that I received, I would respond to personally or have conversations with the patients, and it really came down to the trauma. And of course, trauma, there's a lot of discussion now about adverse childhood events, and there's the survey that you can take to determine what your level of trauma is if you've had X, Y, or Z within your history. And the trauma measures are very, very high. We probably know that already just intuitively without even having to administer a survey, and some programs do and some programs don't. But it relates back to there's historical trauma and there's current day trauma. In the historical trauma, of course, that leads back to the Great Indian Wars, the Plains tribes. I think it's more raw trauma up here because the 130 years ago, 140 years ago was not that long ago, really. And we still have individuals who are still alive, and great-great-grandmothers and grandfathers who can still talk about the trauma way back then when they started seeing individuals disappear or be killed in war, hand-to-hand with the Army and so forth. And then we have modern-day trauma with the level of isolation that we have here in Montana. The poverty that we see on the reservations is also supportive of the trauma and the ongoing. So we see a lot of ongoing behaviors that are really based in trauma.
So can you give us some specific examples about historical trauma? Give us a few examples of things you've seen.
Well, maybe things I've read about, not necessarily
Sure.
seen. I know I'm
Sure.
old, but maybe not that old.
Sure.
One of the books that I started reading that I hadn't read before is based upon a lot of research by two historians, non-Indian historians, and it's called The Heart of Everything That Is. It's really about Red Cloud, who is one of the great American warriors, who is Lakota Sioux. And the story is absolutely amazing. It's based on fact, it's based on history, it's based on written words back and forth, and letters shared with the army at that time, and sending information back east to the Great White Father. It was based also on winter counts and stories of the individuals that they still had available to when they started investigating and really looking at the history. Things such as counting coup. Counting coup was really a warrior's game to show how brave they are, where they would go up to an enemy and tap them but not kill them. And when it started, what happened when they came into the conflict or in contact with the army, they would go up and count coup and run away and be killed. And that was shocking, and it talks about that in this book, and it's really from that perspective of what's going on. This is not how you play this game. That's not the rule. We don't murder. We count coup. We show how brave we are. We run in, we tap, we leave. So that change in the rules was very significant and very traumatizing when they saw things like that occur. Driving us from our homes, our traditional hunting lands and so forth. Bozeman is a good example where there used to be a large meeting area, and we'd come together as tribes, and we could no longer do that in safety. So that in itself is trauma.
Thank you so much, Dorothy. Thank you, Dorothy, and thanks, Tina, for being with us today, and I hope you enjoyed the show. Be sure to come back again next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.